con na nước cầm lạ mà lang chơi
bóng con ta tức lê dân sai sát con ôm phốt cứ sầm khăn như này nó priệt từ chẳng hết á càng trong tiếng ngày mình vui sao nó mình nhà chàng bách chàng bách ô tô hơi thà pram năm nó học con chơi chẳng có mày trẻ ở hải chẳng thằng
hai chẳng bay crom năng cư miên sạ sầm khăn mốc ăn cơm rán tê pi mốc cho mình bay rán crom liên sang ai miền sạch miền bồng tia miền cái đam tròn miền ấy bao giờ chẳng ai để dừng ai rồi ba nơi trở lên nơi ấy nhé cha hai có miền đất bờ này đấy nhà miền phải cha hai giờ qua miền tờ lông thế đấy mình ok ở đây giờ qua thả đi chít mình này đấy tăng tế vì Khmer vì cọ của bảo giờ lấy con luôn dương ao thông ní bắt cái lại tê chà bông vô cầm má tròn hái bông tròn nào đi tiền đó bông đặt mặt thùng hái tại sao đấy cứ ấy phải không tẩy nên các bạn thì ấy là ngày ai vô lục một lục
I first came to Cambodia in 1994, and the very first trip to Siem Reap from Phnom Penh was on board a boat. And while passing by and through some of the floating villages, I was struck first by the poverty, by the lack of hygiene, and I remember turning to my wife and saying, this is a public health nightmare. 1994, I didn't know Cambodia. I didn't know how to do things or get things done. Fast forward a few years, and I am directing a children's hospital here in Siem Reap. And I was approached by the Asian Development Bank to do pediatric outreach to a couple of the floating villages nearby Siem Reap. And these were pretty much tourist visited villages. But I said yes. And for 2 years, we did once a month outreach to just 2 nearby villages. But those 2 years brought home just what need there is in these communities. And in 2007, when I left the Anchor Hospital for Children, I knew exactly what I wanted to do, and that was serve those populations that are living on the lake. And together with Cham and some others who were supporting my idea, we decided to work only in those villages that were very isolated and very remote. And that's where you saw this week. That nearest village is 35 kilometers away from a paved road, from a government health facility. And so 2007, 2008, we were quite modest. I was driving the bus, I was driving the boat, I was doing the cooking, I was assisting docs, I was seeing patients. But as we grew and developed, we had the funding to expand. And with that came a full-time staff of doctors, midwives, nurses. Until today, in 2020, we field 2 teams each week. They go out either to the lake or to the Steung River for 2 nights, 3 days, with the 4th day being an administrative day here in the office. We provide almost 30,000 services each year that range from emergency care to family planning, the chronic disease surveillance and treatment, to a very active and outreach program, which is dedicated to disease prevention. My background, of course, is public health, and it's sort of beaten into your head for years that an ounce of prevention is worth a pound of cure. And so we try to focus on creating healthy communities. We take care of the acutely ill, the chronically ill, but we try our best to teach people how to make healthy decisions and build a healthy life.
Hãy ban Tonle clinic វាសំខាន់នៅទីនេះព្រោះថានៅទីនេះដឹងស្រាប់ហើយវាឆ្ងាយអំពីភូមិឆ្ងាយអំពី health center អញ្ចឹងប្រជាជននៅតំបន់ហ្នឹងគឺក្រៅតែពី Tonle clinic នេះគឺគាត់គ្មានកន្លែងណាមួយដែលគាត់ត្រូវទៅទទួលសេវាហ្នឹងទេ Yep
ផលវិបាកក្នុងការព្យាបាលយើងនៅតាមដងទន្លេនេះទី1គឺការធ្វើដំណើរពីភូមិមួយទៅភូមិមួយជាពិសេសនៅពេលរដូវប្រាំងរដូវទឹកស្រកអញ្ចឹងការធ្វើដំណើរតាមពីភូមិមួយពិបាកដោយសារយើងស្ទះជាពិសេសគឺមានកំប្លោកទឹករាក់អាចទៅរួចបានទោះបីប្រើទូកតូចក៏យើងអាចទៅបានដែរភូមិមួយចំនួន